Hello class. Today in our rhythm recognition class we are going to start learning how to name our rhythms that are coming from the sinus node itself. So when we're looking at rhythms, we are going to just do a quick review of what we learned last week. We looked at our structures of our heart. We said blood comes in through the superior and inferior vena cava and dump into the right atrium. From there it goes through the tricuspid valve into the right ventricle. From the right ventricle, it goes to the pulmonic valve to the pulmonary artery where it branches to the right and left lungs, and that's where our oxygen and CO2 exchange takes place. And then that new, fresh, rich oxygenated blood comes in through the pulmonary veins, 4 pulmonary veins, 2 on the left, 2 on the right, but they all dump into the left atrium, through our bicuspid or mitral valve into the left ventricle, and then out the aortic valve, out the aorta, into the body. We also said we have a septum. We actually have an intraatrial and intraventricular septum. And we said the left side of the heart, as we can see, is much thicker than the right side of the heart because it pumps against a lot of resistance. Right side of the heart deals with unoxygenated blood. Left side of the heart deals with oxygenated blood. We also had these papillary muscles that come, these folds that come up out of the heart, and our chordae tendineae from our valves are actually anchored there. We looked at the conduction of our heart, started with the SA node, sinoatrial node, and from there our conduction, we said our sinus node has automaticity, the ability to initiate an impulse. Usually the sinus node fires at 60 to 100 beats per minute, goes through intraatrial and intranodal pathways. It's held in the AV node for about 0.08 seconds to allow the atria actually time to contract. And then it goes to the bundle of His down the right and left bundles to the Purkinje fibers to spread that impulse through the ventricles. We looked at our waveforms. We said our P wave is telling us that the atria got the message. So our P wave lets us know that the atria depolarized, that chemical and electrical event happened in the atria and it made it all the way through the atria. Now, the way we're going to know if something's coming from, that it's coming from the sinus node, is if that P wave is normal, rounded, and symmetrical across our entire strip. So the P wave just tells us the atria got the message. If it's a normal, rounded P wave, then we know it comes from the sinus node. So the P wave is atrial depolarization. Then we had our QRS, which is ventricular depolarization, so the ventricles got the message. And then our ST segment should be flat, and then our T wave is ventricular repolarization. So our ST segment should always be flat, and then our T wave generally goes in an upright direction. So we're going to start looking at things coming from the sinus node. So that's going to give us our sinus rhythms. So when we're looking at sinus rhythms, one thing that we have to talk about is just a standardized approach. How do we approach a rhythm? So we always want to make sure we're using a systematic approach. You're going to get where within a week or two of this class, you are going to get, after you've seen a few strips go by, you're going to say, oh, that's sinus, oh, that's atrial, that's this, that's that. You're going to pick out certain things that are going to pretty much be fairly accurate of telling you what that rhythm is. But if you don't, anytime you have a strip that you're looking at, you're like, I have no idea what I'm looking at, you always go back to a systematic approach. What lead is our patient in? So we said in lead 2, where our negative electrode is over here and our positive electrode is, so our negative electrode's up on the right, like under the right collarbone, and our positive electrode is on the chest, but towards the left leg. Electricity is seen as how it's going towards the positive electrode. So in lead 2, because the conduction starts in the SA node and travels towards that positive electrode, our waveforms all go upright. So it's nice to know what lead you're in. If you're in lead 2 and half of your waveforms are going down, you already know you have a problem, if there's something wrong. The next thing you're always going to ask yourself is the rhythm regular? And what I mean by regular is the spacing from QRS complex to QRS complex to QRS complex. Is it the same spacing? Or is it irregular? What is the rate? So we'll count how many beats do we have in 6 seconds and we'll multiply by 10. Is there one P wave for every QRS? And is our P wave normal and rounded and symmetrical? Then we need to look at that PR interval from the beginning of the P wave to the beginning of the QRS is our PR interval. our QRS interval, and our QT. And remember, the QT is from the beginning of the QRS to the end of the T. Then we want to look at, are there any abnormal beats? And if there are, where do they come from? What are we going to call the rhythm? And what's the significance of it? But we treat our patients, we don't treat monitors. And the thing you have to remember is rhythm interpretation is giving you one picture of what's happening to your patient. So it's not going to tell you everything. So sometimes people put a person on the monitor and they think that monitor is going to tell you everything, and it won't. So you always have to assess your patient to see if they're having problems. So we'll start with a normal sinus rhythm. Normal sinus rhythm implies everything's normal on that strip. If you have a sinus rhythm, but you have an abnormal beat or an abnormal interval measurement, it can be sinus rhythm with something. So when we look at normal sinus rhythm, it's a regular rhythm. And what I mean, we said, is the QRS to the QRS. And we usually look at the R wave. So from this R to this R, is that time interval space the same from there to here, from here to here, and from here to here? So do you need calipers? No. I mean, if you're great at keeping your things, I remember when I became a tele nurse, I bought myself a pair of calipers, lost them in the first 2 days I worked, went and bought another pair, lost those within a few days, bought myself a third pair. When I lost my third pair within 1 month of working on a tele floor, I decided I wasn't meant to have calipers. You can just hold a piece of paper up and put a little hash mark on your paper here and one on this one, and then just carry the paper from space to space. It'll let you know if it's going regular or not. Your rate should be 60 to 100. The sinus node normally fires at a rate of 60 to 100. There are times it can go faster, there are times it can go slower, but normal is 60 to 100. Now this is for an adult. So I'm going to count how many complexes I have. 1, 2, 3, 4, 5, 6. Now remember, in between two sets, between these hash marks, between this set of hash marks, that's 3 seconds. So between two sets of hash marks would be 6 seconds. So my heart rate would be 60. Do I have one P wave for each and every QRS? And I see I have a nice normal rounded looking P wave, and it looks the same. It looks symmetrical. It looks pretty much the same as it's going across the strip. Do I have normal interval measurements? Now you can see the big boxes here, which is 0.20, but it's really hard to see. You can't really see these little baby boxes that are in it. But remember, a PR interval is 3 to 5 little boxes. Okay, no more than one big box. So from the beginning of my P wave to the beginning of this QRS measurement, I'm definitely less than one big box. It looks like I would probably be about 3 boxes there, which would be 0.12, which is normal. And my PR interval should be the same. This PR interval should be the same as this PR interval, should be the same as this PR interval. My QRS size, does it look normal? Now, if it's normal, great. If it's not, but all the other criteria are present for a sinus rhythm, then we have a bundle branch block. And we'll talk about that some more in just a minute. So QRS, from the beginning of the QRS, so here's my Q, it dips down. So I measure from the isoelectric line before it dips down to where my S wave comes back up. And again, you can't really see those little baby boxes, but it looks like it would probably have been about 2, maybe 2.5 baby boxes. 2 would be 0.08. Remember, each baby box is 0.04 seconds of time. So 2 to 2.5, 0.08, 0.10. And normal QRS size, we said, is 0.06 to 0.11. And then QT interval. Now, I don't need to measure the QT interval to determine what the rhythm is, but it does. It is an interval measurement I want to measure. And so it's great if you can find a QRS that starts on a big dark line. This one starts a little bit before that, but this would be 5 baby boxes, 6, 7, so I probably have about 7 boxes. So I would measure this from the beginning of the QRS to the end of the T wave. And remember, this is telling me how long it's taking the ventricles to depolarize and repolarize, so it can do it again. And we said that downslope of the T wave is our relative refractory time. That's our dangerous period, where a strong impulse landing on this downslope of the T wave can cause electrical chaos. So if everything is normal, I've got a regular rhythm, I have a rate between 60 to 100, I have one P wave for each and every QRS, and all my interval measurements are normal. I have no weird beats looking at it. It is a normal sinus rhythm. So I can abbreviate it NSR, or you'll also just see it abbreviated SR, sinus rhythm. So, and you always want to put the rate. So sinus rhythm at 60, or normal sinus rhythm, NSR at 60. You'll always put the rate on your rhythms. Okay, this one here, regular rhythm, QRS to QRS to QRS to QRS to QRS to QRS is regular. My rate in between two sets of hash marks, 1, 2, 3, 4, 5, 6, so rate is 60. I have one P wave for each and every QRS, and my P wave looks normal, rounded, and symmetrical. So I think it's coming from the sinus node. And now I want to see how many little boxes do I have. So from the beginning of the P wave to the beginning of the QRS, it looks like I have 1, 2, 3, just a hair over 3. 3 would be 0.12. So it's 0.12, 0.14 at most. Okay, that's normal. Okay, we said normal was 0.12 to 0.20. QRS. Dips down for my Q, goes up for my R, comes down for my S. So I measure it from here to here, and it looks like you're maybe 1.5 boxes there, so 0.06. And then QT interval from the beginning of the QRS to the end of the T wave. And I'm just looking to see if I find one that's actually starts on a dark line, which I don't really see. So we'll go ahead and we'll go from here, and it looks like I have 1, 2, 3, 4, 5, 6, 7, 8, 9. I get these are really hard to see. Okay, so but it looks like it's about 9 boxes, which would be 0.36. So this would be SR at 60, or I could say NSR at 60 or SR at 60, either way. Now you'll notice that this P wave looks different than this P wave, but they're still normal, rounded, symmetrical, and look the same. I mentioned this before, it's kind of like your thumbprint. Everybody's will look just a little bit different. So this one here, QRS to QRS to QRS to QRS, looks normal. My rate here happens to be 60 again. One P wave for each and every QRS. PR interval looks like from the beginning of the P wave, it looks like I have 1, 2, 3, looks like 4 boxes, so 0.16. And again, that should be the same measurement here, should be the same measurement here, it should be the same all the way across our strip. So PR interval is 0.16. QRS, from the beginning of the QRS to the end of the T wave, it looks like I have 1, 2, looks like 2 boxes, 0.08. And here, my QT interval looks like I have 1, 2, 3, 4, 5, 6, 7, 8, 9 boxes, so 0.36. And we said QT should be 0.40 or less in normal heart rate ranges. In bradycardias, you might see it be a little bit longer than that. Now, this is showing you in 2 leads. This is lead 2 up here on the top. It's an MCL on the bottom. Exact same person. So you see here on lead 2, my P wave goes up, my QRS goes up, my T wave goes up, where here my P wave is biphasic, goes up and down. My biggest bulk of my QRS goes down, and my T wave still goes a little bit up. So, and that's okay. This is normal for an MCL or a modified chest lead 1. This is normal for lead 2. So here I have a regular rhythm. My spacing here between my beats looks normal. My rate here would be 1, 2, 3, 4, 5, 6, 7, so rate is 70. I have a P wave for each and every beat, and it's normal, rounded, and symmetrical going across its strip. PR interval looks like it is 1, 2, 3 boxes, so 0.12. QRS looks like it's about 2 boxes at most, 0.06 or 2. I can't tell if it's 1.5 or 2, so 0.08. And my QT interval looks like it's 1, 2, 3, 4, 5, 6, 7, 8. It looks like it's almost 9 boxes, so 0.36. So again, sinus rhythm at 70. Now the monitor might be saying sinus rhythm at 74 or sinus rhythm at 75, where you can only get even numbers. You're going to get either 70 or 80 depending on where you ran the strip at, and that's okay. Okay, so long as it's similar. Okay, so we'll continue this in just a moment.